All right, Pam, I see that looks like you're ready to go. You all set?
Just give me 30 more seconds. I just want to make sure that the YouTube live stream is muted on my device.
Okay, just tell me when you're ready.
Okay, all set. Thank you.
I'm going to call the meeting to order. I'd like an approval of the minutes from April 1st.
So moved.
Thank you. Can I have a second?
Second.
All in favor of the minutes as stated?
Aye. Aye.
Opposed? Minutes are carried. Thank you. Okay, human resources, page 6. Is Anita here? All right, we're gonna skip resolution 1 and we're gonna wait for Anita. Hopefully she'll be coming. I know that Paul is on, so we'll go to the contract amendment and budget amendment for the health department. Can I have a motion for resolution 2, please?
I'll make that motion.
Thank
Second.
you. Second by Andrew. Okay, Paul, are you on?
I am. Can you hear me?
Yes, we can. Go ahead.
All right. Good afternoon, everybody. So this is a contract amendment. A couple weeks ago, we had an approval for $67,490, and they have given us some additional funds in the amount of $27,883. This is CDC funds coming through HRI, which is the state's arm, fiscal arm for dealing with CDC contracts. So again, this is funds directly related to our COVID-19 response in the health department to pay for overtime costs, PPE, other related costs relative to our response.
Thank you, Paul. What is the status of the PPE? Are we beginning to get more, or are we still terribly short?
Yeah, we're still terribly short, unfortunately. Obviously, as you guys are well aware on all the calls we have frequently, we're working with emergency management closely. There is a little bit of flow coming through there. There are some reports of some levels of PPE coming in for this Friday, some percentage of what we've been ordering, but it still fails in comparison of what we've asked for and what we really need to be made whole and for the response we need, not just in the health department, but in our healthcare system and for our community partners.
Thank you, Paul. Any comments or questions for Paul?
And just following up on that, Madam Chairman, this is a statewide problem that our county EMO people have been constantly making inquiries and asking repeatedly since the state so controlled all this. Where is it? When's it coming here? And don't just tell us that we've got tons of hand sanitizer, because that's about what it is. But we've worked very well with our partner UMMC and the RGH system to help us get some, particularly some of the tests, if I'm not mistaken. Correct, Paul?
Yes.
But it still pales in comparison to what the state OEM supposedly is control of. But when they are talking with our local people, there's no answers and a dearth of any kind of schedule of when's it coming.
I know it's been a big frustration when I've been in the EMS calls and with the E911 meeting that we had this week. Very frustrated bunch of people there. Go ahead, Shelley.
Paul, I wanted to ask about the support that we're giving for your personnel. Do you have enough personnel? Have you been able to fill those emergency spots for staffing that we approved just recently?
Yeah, so obviously, number one, I appreciate the question, and I have felt a strong level of support by the legislature. Many of you have reached out over and over again around the staff, and it is well received, and I do pass those messages along that you as the legislative body are very concerned about them and their well-being and the hard work and the many hours they're putting in. There is a lot of overtime, especially on the weekends on our nursing level and our epidemiologists. We do have all of our positions filled, the ones that you had approved, so they are on board and working. We also have been receiving a lot of support from our fellow county departments. Jay and Matt specifically, and Anita have been helping to facilitate additional capacity. We have folks from other departments that are helping us drive and do our daily mandatory checks on those in quarantine and isolation. We also have trained folks to help us with case contacting. So there's a big collaborative effort to, make sure we have the resources we need to address this. So, although I think there is some level of, tired eyes and a lot of yawning, we've been going through a lot of coffee over here in the public health department. But beyond that, I think we're holding together, and it's a group effort, and I think people are doing a great job in tracing down these contacts and containing them, which is really the ultimate goal here. So, it's ongoing, and we do appreciate all the support and the encouragement there.
Thank you, Paul. Is there anything else you want to share with us, Paul?
We just released our update for today. You may have seen already. We're up to 80 cases confirmed.
Yep.
We did report, unfortunately, a second death today in Genesee County. So again, unfortunately, we knew that we would continue to see both increases in cases and unfortunately deaths attributed to COVID-19. The one thing that I do want to point out, if you do have a chance to look at our tracking system, which, I'm very, very proud of. I've compared it to some of our neighboring counties and around the state. And I think Aaron Pence has done a great job through planning to really provide great data for our folks in our counties. And, the nice thing that we have is we have the confirmed case layer and also the active case layer. And if you look at the mapping around that, you can see that although our cases climb cumulatively, our active cases are actually trending downward. So that is a great sign. And you've probably seen that in the numbers we've had, where last week we were pushing 8 to 10 to 11 a day. This week it's been onesies, twosies, threes. So, again, increase in cases overall, but our total active cases are trending downward. So that's a good sign.
That is a good sign. Thank you.
Yep.
All right. Is there any other comments or questions for Paul regarding resolution 2? All those in favor say aye.
Aye.
Opposed? It's carried. Thank you.
Thank you. Have a good night.
Appreciate it.
Well,
Is Anita on? I don't think she's here yet. Okay.
Haven't seen her yet. I sent a note to her. Haven't had a response yet either.
All right. Let's go on to referrals from public service. John, would you like to do that, please?
Yes, ma'am. We got established the capital projects for highway fire alarm system and fire alarm control panel at 5130 Main Street for a total of $112,161.
Thank you. Can I have a second on this resolution? Thank you, Shelley. Comments or questions? Hearing none, all those in favor say aye.
Aye.
Opposed? That's carried. Thank you. Jay, we'll go on to you, County Manager.
Jay, unmute.
I believe Anita's trying to get in right now.
Pam, can you let me know when she's on? Because I can't see her listing here.
Sure. There are a couple of numbers that I'm unable to identify. I don't know if one of them is Anita.
No, it would not be, Pam. This would be something coming in literally right now.
Okay.
All right, well, let's give her a few more minutes. Go ahead, Pam, with yours. You have a resolution, I believe.
I do. This is the standard workday and reporting resolution for elected and appointed officials. This pertains to all elected and appointed officials who start a new term and are members of the New York State Retirement System. Of the individuals listed on the resolution, Shelley, Greg, Andrew, and Mike Sanfrini all recertified their record of activity. And Christian Juncker is a new legislator, completed a 3-month record of activity. These are the results, and I'm asking for your approval of this.
I'll move that, Mary Ann.
Thank you, John. Second, please.
Second.
All right, Andrew, thank you. Comments or questions? All those in favor?
Aye.
Aye.
Opposed? That's carried.
And your next meeting is Wednesday, May 6th.
Thank you. Any sign of Anita yet?
Oh, Mary Ann, let me give you a little update on what we've been doing. In general, you know that we're in the process of setting up another conversation with you folks later this week. Also, we are continuing to pursue with our friends at NISAC what the state is or is not doing with regard to the first 2 stimulus bills, and particularly the FMAP Medicaid weekly share adjustment, as well as what they're trying to put together in a corrective measure they're now calling COVID-19 3.5 at the state level. As we've heard on our conference calls with our friends at NISAC, and also another subgroup that involves managers and administrators across the state, we continue to ask them questions as to what level of detail they have on both what the new budget is laying in store already with regard to the AIM payments, but also particularly all this federal money that is is literally in Albany, 2 rather significant drawdowns, advances to the state of New York, part of which has our name on it. And I mean all 57 counties, but we have heard little or nothing as far as the state of New York itself is concerned as to what they are going to do with what I believe is a required benefit to the counties of New York State to the tune of about $1.6 billion, including the city of New York.
That's, and when will we know, have more information on that as far as what the numbers are actually going to be?
We continued and you know, Steve Aquario, Mark Levine, Dave Lucas, Ryan Gregor have continued to press both the budget director, Mr. Mahika, as well as the governor's office with regard to, we know that's out there. It's not some kind of governor's discretion. It was set up because of the federal legislation back in 2009, again in 2012, in what was adopted in the New York State budget. It was just adopted, you know, basically 15 days ago. Those things are part and parcel, and the governor did not get his way in terms of what he's doing with New York State Medicaid. Understand also the state itself, out of this first and second stimulus bill, is picking up $5.26 billion in Medicaid federal aid. We're saying we need to know when and how you're going to implement our $1.6 billion, and we need to see what the plan looks like as we're trying to make all these other contingency plans for how county governments survive going into the next 2 quarters, and what we will see likely as changes in our sales tax proceeds.
So we just, it's a waiting game. But, you know,
Unfortunately, it truly is. I guess the only leverage we may or may not have is the senator himself and Senator Gillibrand, in terms of, you know, they fought hard for everybody in New York State, particularly when it comes to Medicaid, that all the people who are paying also derive some benefit from this additional 6% additional FMAP New York State piece. And for it to be sitting there on the sidelines when everything else is moving quite quickly when it comes to things that are seemingly advantageous to the state of New York, it's somewhat disappointing that the counties are not getting that kind of clarity and understanding of what the plan is for that benefit to be derived into our budgets.
I guess there's nothing moving until the governor gives his approval on all this stuff.
That very well may be, Gary. And I think that, like I said, the hammer is that we know the way the legislation and the bill, the federal legislation was signed, includes, in this case, New York State county governments who are paying Medicaid weekly shares.
anything else, Jay?
Not for right now, no.
Okay.
Anita is on, Mary Ann.
Oh, great. Hi, Anita. Can you hear us? I don't think she's unmuted.
She's only on the video piece. Doesn't look like she's got the audio set up yet.
Oh, boy. While we wait for her, Shelley, did you want to just go over what we had discussed prior regarding the state of emergency being continued? Can you give some insight on that? I know you have the document there.
Yeah, Genesee County Health Department requested that our state of emergency declaration that was signed in March be extended as of 12 a.m. Tuesday, April 14th to May 12th of 2020 as per the governor's executive order 202.16, as he's continued the state of emergency in the state of New York until May 12th, 2020. So I have signed the emergency declaration and have provided it back to our legislative clerk, who will be providing it to the county clerk. So I do believe that that extends our 50% workforce. Jay, you're nodding your head. I'm going to let you take it from there.
Yeah, Shelley, what we basically have done is EMS and the health department made sure that what's in the new extension is consistent with what we know the state does or doesn't have to approve as far as our declaration, state of emergency. We can do it for 30 days because it is a state of emergency, not an executive order, which can only go for 5 days. Excuse me. And the other situation is that this continues our ability to be very flexible when it comes to particularly FEMA programs, and what our people are doing as far as both documentation and attribution to Federal Declaration 4480 with regard to reimbursement, tracking thereof, and any actions underlying that. So again, it to some extent, and you're right, does dovetail with what the governor is doing with regard to extending the provisions of his earlier declarations, particularly with regard to the public sector versus private sector and the nonprofits. So we are still at the 50% with regard to essential, non-essential. Our percentage actually is under that on an average daily basis. And we continue to make plans. And as Paul discussed, making up potential options to our workforce so that they can help out in the situations like what's going on at the health department with the increasing numbers, as well as the contact tracing that has to go on, and people helping do that. They're actually using the IT conference room out of County Building 2. And that again is helping us keep up with what we need to do to keep the community safe, but also make sure that the individuals we're dealing with, they understand and have both their isolation, quarantine, and orders all in order and functioning as best we and they can.
Thank you, Jay.
Thank you. Do we have Anita yet? Because we're going to have to move on this, I think.
Yeah, I think I can speak for what we did and what Anita put together. We have two pieces of legislation, one from the federal government, one from the state, that says under COVID-19, and with these two pieces of special legislation, counties need to have a policy in place as to how, and I believe we have approximately 9 individuals who may be affected by this, have to have these kind of joint plans in place with regard to, as you can see in the whereases, what goes on as far as state paid sick leave law, and then the federal FFCRA law. And that's what this basically does, is melds those two things together. And that's what we're asking you to approve in this resolution number 1.
I would move that resolution.
Thank you. Do I have a second?
Second.
Thank you, Andrew. Comments or questions?
I think Anita might be on now.
I am. Can you hear me?
Yes.
Yes, we can. You got here.
Oh, sorry about that.
By accident.
I got caught up on a conference call. I apologize.
Okay, we're discussing the paid sick leave policy. What would you like to add?
I think Jay added everything, and the only other thing I would say is that what we're doing right now is we're just looking at each case on a case by case. when we know of somebody being out, we're sending them a letter and asking them to return the application along with documentation, and then we're reviewing that against each law to see what they qualify for. And then we're having them use their sick time at this point, and then if they qualify, we will go in and adjust them to the appropriate law that they fall under.
How about if they don't have available sick time or they're new employees, they haven't banked a lot up? Anything like that happening yet?
Not yet. We haven't had that. Most of them have either had leave credits, so we've been able to have them use some kind of a leave credit, whatever the contract allows, and then we will be reimbursing them if they qualify.
And this was enacted in conjunction with the labor attorney, correct?
Correct.
Developed, yes, okay.
And
Yes.
Anita,
Yes.
isn't it basically that what this is really for a lot of employers, unlike county governments and local governments who don't have a lot of leave credit benefits and things of that nature, this is a sort of a floor underneath a lot of people who, because of the illness and the protocols that are established for determining a direct relationship, guarantees the employee something that normally they wouldn't get. We have a fairly adroit and rich, benefit package that includes paid sick leave already. But we have to adapt into this just in case, as you indicated, we have somebody who just started with us and they came down with it.
Yes, they would have to. We can't charge them leave credits if
Right.
they fall under this. So they would get up to, in most of the cases, they would get up to 80 hours, depending on the number of hours that they work a week, but the max that someone could get would be 80 hours. And then depending on what the issue is, if it's a child care issue, they actually would get 2/3 pay, and then they could supplement that with leave credits.
Thank you. Shelley, I think you had a question, go ahead.
I do. So Anita, you indicated that you have an application. Is that something that has been devised by the county, or is this an application that our labor attorney has put together?
Using the guidance from the direct Department of Labor, our labor and relations attorneys have put this together because at this point, the Department of Labor has not issued any guidance in that, and they have not released the forms. So in order for us to have something to, in order to evaluate this, they've used the guidelines that the Department of Labor has set up. Once the Department of Labor releases their forms, we will use their forms. But in the meantime, we've created our own using their guidance, which changes daily.
Basically, Anita, that's really a vetting process to make sure that, like, as in your chart that you have here, these things are questions, sort of a Q&A that the employee and HR can make sure are answered, so that it doesn't just say, well, we have to wait for the application, so nothing's going to happen.
Right, and in order for us to get reimbursement, if there is reimbursement in the future, we have to have the proper documentation.
Right.
Thank
Anita,
you.
you're
Go ahead, Gary.
Anita, I'm assuming this
Yes.
will go to department heads once it's approved by the legislature. And is this going to be coded in the financial system?
Yes, we have codes for both, because under this law, the federal law, there's two branches that fall under there. So it depends on what somebody qualifies for. So we've got two codes for that. And then we have a New York State code as well. Pretty much the New York State code will only be used if someone actually traveled out of the country and then had to be quarantined, or if someone actually has COVID-19. Most of the employees are going to fall under the federal law. So yes, I actually think there are 4 or 5 different codes, and we're going to be keying them in HR, because I think it's going to be way too confusing to have the individual departments key it. So as we evaluate, we'll go in and adjust payroll and put those on the person's payroll to pay them.
Thank you.
Shelley, go ahead.
So Anita, at what point do we have the opportunity to adjust these codes? Is this just going to be going forward until that Department of Labor guidance comes out, and then perhaps even after that, we might go back and recode time several times during this year?
These laws are in effect until December 31st of 2020. So people will be able to use them till the end of the year at this point. So I think at this point, I'm pretty positive we have everything. We may have to go back 2 weeks, and like I said, we think we have 9 cases right now that we're evaluating. So we may have to go back a couple weeks, but I don't anticipate we'll have to keep going back further.
Well, kudos to the group for creating a application according to the guidance so that you at least have some record of how the measurement was made for the coding. Good job.
Yes, it's been every day the Department of Labor is changing their guidelines. So it's been a constant struggle for the attorneys to evaluate everything, and we've updated this form several times. But I think we're at the point where we have it and it's good until the new ones, if they release the ones from the Department of Labor.
Anita, do you know if we do get reimbursement? Can we get reimbursed for attorney fees?
She is billing us separately for anything that has to do with COVID because we do believe we will be able to get reimbursement since it is something that normally we wouldn't be doing.
And
We'd
would
probably
that,
classify that as sort of extraordinary expense related strictly to C-19.
so would that all go through the CARES Act? Is that, or is it one of the different funding mechanisms? Which one do we know that we're gonna pull down on for that type of personnel cost, or is that yet to be determined?
I think that's yet to be determined.
Thank you, Anita. Thank you for your.
You're welcome. Thank you. I apologize for being late.
That's all right. We know you're working hard. Any comments from Andrew or John? Questions?
Nope, I'm good.
Thank you.
I'm good.
Okay, great. Any other legislator comments or questions? All right, I want to reiterate what Shelley just said. Thank you so much for all your hard work. I know this is a process. We're not at the end of the road yet. We're in the middle somewhere. And we'll just take it as it comes. I think the most important thing regarding this to me is that we do not want our employees coming to work sick.
Correct.
So
Right.
if they are home, they are sick, we need to have them stay home so that we can control the spread of this illness. And that goes countywide, but we have to start with our county employees that we set the example. We do not want
Absolutely.
employees who are sick.
It's diligence and persistence as far as that's concerned, and awareness.
Absolutely. All right, thank you. I'm going to call the vote if there's no other comments or questions. All those in favor of this policy, say aye.
Aye.
Opposed? That's carried. Thank you, Anita.
Thank you.
Take care. Okay, Jay, we already heard from you. Do you have anything else to add with regard to this? or
Not at the
anything
moment,
else?
Madam Chairman.
All right. How about you, Pam?
Nope, I'm all set. Thank you.
All right. Any other comments from the legislature?
Can I ask Jay a quick question, or maybe on everyone's behalf? Where are we with the county clerk's office? I know they were making some plans to provide some limited services. Are we in the process of that?
They have been, I had to unmute myself.
Yep.
They have been working with a smaller staff, taking care of the dealer work that they had, and also dealing with the stuff that comes in either through the mail or through the drop boxes, which can be, something that doesn't even have a postage stamp on it. So they are functioning and keeping up with that part of the work. There are no public visitations in either of the departments, upstairs or downstairs. But there is staff each day working in the two parts of the Genesee County Clerk's office.
So we are not closing real estate transactions just yet, is
To
that
the
right?
best of my knowledge, they are not. And again, Michael has made arrangements through our computer system, and some of that stuff can be done remotely. I'm not sure that the completion of the process is yet that automated.
I do know that they are closing, not necessarily our people, but through title agencies, real estate transactions are closing and are being filed. Again, I don't know that they're being done by our people. I don't think they are.
I think, and again, to the extent that that's the thing that the contract technology company has brought to the table, is that more and more of that can be done without actually passing back and forth and doing those things, and the capability to recognize signatures without the person's signing it in front of you in blue ink.
Thank you, Jay. Any other comments today? All right, seeing none, I'll take a motion to adjourn this meeting.
Motion.
Second?
Thank you. Thank you, Andrew. All those in favor?
Aye.
All right, we're adjourned. Thank you. Thank you all.
Thanks, everybody.
Stay safe.
Take care.
Have a good night.
Same to you guys.